Hello, I'm Patricia Henderson with Senior Connection Center. November 11th was initially established as Armistice Day to celebrate the end of World War I. Over time, it has become a national holiday to celebrate all veterans. On this Veterans Day, we want to provide some information to you about services and resources available to veterans and their families. Joining me today are Lee Washington, County Veteran Services Officer for Manatee County, and Kevin Gilds, Veteran Services Contract Manager at Senior Connection Center. Thank you both for being here today.
My pleasure.
Thanks for having us.
Lee, what types of services are provided by Manatee County Veteran Services Office?
Our whole role is to advocate for veterans. So we are responsible for ensuring the delivery of disability benefits to veterans and the surviving spouses, healthcare applications, long-term care and low-income pensions, information on education benefits, housing benefits, and of course, linking those veterans and their family members to community organizations to help in areas that we cannot.
What are some of the benefits that may be available to veterans based on eligibility?
Well, the largest part of what we do here in the office have to do with service-related disabilities. And service-related disabilities are those injuries that were incurred or aggravated by active duty service to the nation. And that's typically handled by compensation provided by the Department of Veteran Affairs, to include health care provided by the Department of Veteran Affairs for those disabilities. We also help veterans who are not service-connected for any disabilities linked with VA healthcare. VA healthcare is a benefit that is eligible for veterans who served honorably, who meet the income and asset guidelines. I take that back, no asset guidelines. They removed those guidelines a couple years ago, but link those veterans to VA healthcare here in Bradenton, as well as the main VA Medical Center in St. Petersburg, Bay Pines. We also assist veterans, as I mentioned earlier, in the low-income and long-term care pensions to help them afford long-term care such as assisted living, nursing care, or even nursing care inside their homes. We also educate veterans on their benefits that they've earned on active duty for burial at the National Cemetery. As you know, we have a national cemetery down in Sarasota for all honorably discharged veterans and their dependent spouses. There are certain circumstances where their dependent children, depending on their age or if they were fully disabled by a certain age, that they would also have earned that right to be interred at the National Cemetery. We also speak to them about their certificates of eligibility if they're wanting to use the VA Home Loan Program, as well as some education benefits. But we have a strong partnership with all the colleges in the area to link those veterans up who are looking at furthering their education.
Kevin, Senior Connection Center has a veteran-directed care program. Will you explain a little bit more about what that program is all about?
Certainly. The Veteran-Directed Program provides veterans with opportunities to just self-direct their own long-term care services and supports to help them maintain living independently at home. The eligible veterans are able to manage their own budget, decide what services meet their needs, and hire and supervise their own workers that provide care to them. A veteran or their POA can serve or appoint an authorized representative to help them manage that program, because they're responsible for managing the payroll and supervising their own workers rather than having an agency come in to provide their care. Many of the veterans hire their spouses or their children to provide care for them.
Sounds like a program that could really empower veterans.
That is the hope. It's very popular. Our main goal is for them to live in their own home and to manage their own care.
How does someone connect with that program?
Well, first they have to have already be connected to a local VA hospital have healthcare benefits from the VA. program previously. And so when I get calls, that's my first question, is if they're already connected to a VA hospital in our area, because we do work with James Haley, Bay Pines, and the Orlando VA Center.
So we've talked about some of the veterans benefits, but Lee, are there benefits available to spouses of veterans as well and dependents of veterans?
Yes, there are some, depending on when the veteran served. The low income and the long-term care pension that I mentioned earlier, for those wartime veterans and their surviving spouses, there is a monetary benefit that extends to that surviving spouse should the veteran pass away. It's there to assist them in affording long-term care. If a veteran is 100% permanently and totally disabled by their service to the nation and has been certified by the VA, there's also what's called CHAMP VA, or health insurance, provided to those dependents through the Department of Veteran Affairs. Should that veteran then die or pass away from a service-related disability, there is another monetary benefit that's not based on their need for long-term care. It's pretty much an annuity payment paid to the surviving spouse or the surviving dependent, if there is no spouse, for that veteran's death being caused by service.
Now, the benefit that you mentioned, many times it's known as aid in attendance. Is that correct?
The pension program, yes, it's aid in attendance, but we try to explain it. Aid in attendance is a part of the non-service connected pension program. So a person would first have to qualify for the non-service pension program, which is based on wartime service, their age, and their overall income needs. And then aid in attendance is the highest level of that pension, should they need the aid in attendance of another individual.
Does every county have a Veteran Services Office?
Every county in the state of Florida does. Some other states are run mainly by the states, or there's some counties throughout the nation that may run their own county in a neighboring county. We're very fortunate in the state of Florida, all 67 counties has an office just like mine.
And how does someone reach your office?
Our office here in Manatee County can be reached at the phone number of 941-745-3795. You can also find us on social media on Facebook. The association, for those that may be seeing this that do not live in the Manatee County area, can go to cvsoafl.org and locate the representative in their area for the state of Florida.
And we will have that phone number and those websites at the end of the video for you. So if you are watching from Manatee County, or if you are watching from another county in Florida or another state, there will be a link for you to check out and find the Veteran Services Office near you. How has COVID-19 affected the Veteran Services Office? And are you fully open now?
Well, it affected us greatly. It gave us an opportunity to reassess exactly how we did business. Last September, we were fortunate. We purchased an online management system. So when COVID did hit, it only took away our ability to meet face-to-face with clients. We still had the ability to do the full suite of services that we had before, because with that software, it allowed families to look at their documents online, sign them on their tablets or smartphones, and they would come directly back to us for electronic submission to the VA. Our office is fully open. We only see face-to-face clients on Tuesdays and Thursdays as need be. But for those folks that were familiar with our services before, we have moved to our own location, which again, you'll be providing that information after this. But we were open for folks to stop in anytime to get more information, and we will be happy to set them with an appointment if need be after that.
So if someone is a veteran and they're not sure whether they would qualify for any services or not, is it worth a call?
Most definitely. Probably the best spent 5 minutes they would ever have when it comes to veteran services. We try to ensure that when we have a family on the telephone or in front of us, we try to answer any questions that they may have or they don't have. We try to make sure that they have all that information before they walk out the door.
Great, such great information today. Kevin, do you have any final thoughts for us?
I wanted to just point out that if a veteran or a family, if they are connected to one of the local VA hospitals and they're interested in the veteran directed program, they would want to go through their VA social worker or primary doctor and ask about that program, the veteran directed program. For follow-up, there is a waiting list, but the only way to get on, is to get your name in the hat. And it is just based on, if you need if you would to need a home health agency, you would probably qualify for the veteran directed program. But that's a way to get on the list, so to speak, is to speak up. If you're not connected to a VA health system, I would urge them to contact one of the county offices for benefits and start there.
Lee, final thoughts for us?
I would just, echo some of the previous comments, but just to let folks know that we're all veterans ourselves. Florida statute mandates anyone who is a service officer must be a wartime veteran themselves. We have walked the walk alongside of these folks who are doing some of the same things they've done in the military. And they have to understand, well, we want them to understand, I should say, that they have an advocate in pursuing their benefits. They have earned these benefits and services, and it's our responsibility that they receive them.
Thank you so much for your service, Lee, and thank you to all veterans who have served. I'm Patricia Henderson, and this is your Weekly Connection.